Hi, and today is day 10 and we're talking aspirin, and I love talking about aspirin. It's such a wonderful drug. It was, first patented by the German drug company Bayer, and that was in the 1800s, believe it or not. Billions of this tablet have been produced and consumed worldwide, so it is almost the ubiquitous pharmaceutical agent. It does a heap of things. It keeps the blood thin. It stops those things called platelets, which are part of a clot. It stops them from clumping together. But aspirin's also good for pain and inflammation because it affects prostaglandins. So it can lower your temperature, it can reduce your pain, and it can stop your platelets being too sticky. We use it in hearts, particularly in people who have a build-up of plaque in their arteries, and specifically it's almost a non-negotiable for people who have had an event with their arteries, an event such as a stroke, a heart attack, a stent, bypass grafting. These are people who are known to have a problem, and we're looking to prevent a second problem. Aspirin works at doing this. Now, some people are allergic to aspirin, and there are agents that we can use as a substitute, but the idea being that if you've got unhealthy arteries, if you've had an event, then to prevent a second event, and we call that secondary prevention, thinning the blood using antiplatelet agents, aspirin being the cheapest and most broadly available, really works. One of the confusing bits though is, should you be on aspirin before you have a problem? Well, this is super confusing because if you think about it, sounds like not a bad idea, but just taking aspirin alone for no good reason, like any agent, any medication, any drug, could carry a downside without an upside. So if you've got healthy arteries, we believe that taking aspirin probably carries greater risk than not. And that's because the thinning of the blood leads to increased risk of bleeding. So no question, for people who've had an event with their arteries, they should be on aspirin. But for people who haven't had an event, it's not as clear, and we probably wouldn't recommend it broadly. In my own practice though, I'm really interested at looking at people who look well on the outside, and I'll often get a scan of their heart, a scan called a calcium score, so that we know if there's plaque in the arteries. Now, if I identify someone who's got high risk plaque, lots of rust in the pipes for want of a better term, then I would think that those people are likely to benefit from taking aspirin preemptively. Although interestingly, we have no data, no randomized controlled trials at this stage that support that. But if you think it through, if you find someone who's at really high risk before they've had an event, and let's say they have their heart attack at 12 o'clock at night for ease, and for the sake of this conversation, if we could catch that person and give them their aspirin at 11:59, then that would have to be helpful, because we know if we gave those people their aspirin at 12 o'clock sharp, all our research suggests that it's going to be beneficial for them. So if we got them at an hour before, a day before, a week before, or a month before, then if we are dealing specifically with those high-risk patients, it makes logical sense that it should bring a benefit. Well, there's lots more in the resources provided for this day, so do check those out, because this is a really interesting story. There's also a little bit of information that aspirin may reduce risk of recurrence of colorectal cancer. I'm going to leave it for today. I do wish you the very best. I hope you live as well as possible, for as long as possible, and keep going with your challenge. Take care, and bye for now.